Thank you for having me this morning. I'm going to try to be as brief as I can because I know we're kind of behind on schedule. So I just wanted to come speak with you this morning a little bit about breast health and about breast care at Haywood Regional Medical Center, which is where I'm been a physician for the last 3 years, and Rod has graciously allowed me to put forth a program for Breast Care Center, which is a passion of mine. So just want to remind everybody that Sunday, May 14th is Mother's Day. So if you haven't gotten your gift yet, your mom, your sister, your wife, your daughter, what better present than to give them the gift of health? So just wanted to tell you a little bit about why I'm passionate about breast health. This is my mother right here, if you can kind of see that. When I was a second-year resident in surgery residency, she was diagnosed with breast cancer. She did routine screening mammography, and they found an abnormality on her routine mammogram. She had had a normal mammogram a year before that. So when she went through her procedure, she ended up having stage 2 disease. She had a lumpectomy, had a lymph node that had cancer in it, and then had to have all the lymph nodes removed underneath her arm. She ended up having chemotherapy, radiation, and then hormonal treatment for 5 years. I'm proud to announce that she is now 7 years, almost 8, cancer-free, and is doing great. But having seen what she went through in her physician's appointments and the stress that she went through with her diagnosis, it basically changed the way that I practice medicine. So I really try to put forth a personal touch to my patients when they get diagnosed, because I've seen how scary it is to get diagnosed with cancer. So because of that, I have a particular passion for this and really want to spend the extra time with my patients to make sure that they're comfortable with all the decisions that are involved in their breast health. So, just to give you some background, this is a very busy slide, but basically breast cancer is behind skin cancer is the most commonly diagnosed cancer among women in the United States. There are over 3 million women who had breast cancer in 2014. That is an old number, and I bet that number is probably higher nowadays. 1 in 8 will be diagnosed with breast cancer in their lifetime. I tell people there are 8 women in my office, and one of us is going to be the lucky one that gets that straw. The risk in 1970 was 1 in 11. I think part of that increase in more frequency is because of better detection, and as well as people actually talking about it, whereas back in the 1970s you really didn't talk about your breasts. It is second only to lung cancer for cancer deaths among women, which should not be the case. This is a totally preventable cancer, and there are ways that we can attack it early. If you look at this figure, if you can see it, the primary numbers for diagnosis of breast cancer is in the 40 to 75 range. And so that's why we're really pushing mammograms to be done between 40 and 75. There was a lot of media coverage recently about a study out of Canada suggesting you only have to get mammograms every 2 years. That study actually looked at death as the endpoint. And if you ask me, having seen my mother go through chemotherapy, I think you should look at quality of life as well. So at this point, we recommend that all women over the age of 50 get mammograms once a year, because if you get diagnosed in stage 1 and you don't have to have chemotherapy, it's a lot different than being stage 2 or stage 3 and having to undergo chemotherapy. So just a little review of breast anatomy. The breast is composed of globules that produce milk, and then they travel through the ductal system in order to provide milk for the babies. You can have all kinds of pathology along those structures. The most common is that we see tumors in the ducts themselves. You can have abscesses, you can have cysts, fibrocystic disease, all kinds of pathology, and we want to be able to help take care of all of those pathologies. The lymph nodes are what drain the breast underneath the arm. As I mentioned with my mother, she had 1 lymph node that had tumor in it and then had all the rest of her lymph nodes removed. So 5-year survival rates for breast cancer: if you're diagnosed early, stage 0, which is pre-cancer, or stage 1, there's close to 100% chance that you'll have a 5-year survival rate. As you go down, those numbers decrease. Stage 2, there's a 93%, and then you get to stage 4, there's only a 22% chance that you'll be alive in 5 years. So we need to find it, and we need to find it early. And if you can't read that, it says, "Yes, I did have my mammogram today. Why do you ask?" Her boobs are kind of flat. So what can women do now? Number 1 is doing a self-breast exam. As a physician, I see a lot of my patients about once a year, and I don't find subtle things that you may notice by doing breast exams routinely. I know it's a pain. It's a pain for me to do it. I have a 5-year-old and a 3-year-old. The last thing I want to think about is doing a breast self-exam once a month. I tell my patients it doesn't have to be a big production. Pick a day that means something to you. So pick your birthday. My birthday is the 9th, so the 9th of the month, that's when I do it. And all you have to do is before you get in the shower, look at yourself in the mirror, look for any skin changes, any pulling, anything that looks different than it normally does. You put your hands on your hips and look and see if that changes anything. Hands above your head, see if that changes anything, and then you just bend over. If it looks all the same, then you're good. You get in the shower. When you're in the shower, then just soap up real good and do an exam. There's 2 methods to do it. One is the lawnmower, so you guys can envision going across, up and down, up and down. Personally, I'm a circle girl, so you go in a circle and then kind of go towards the middle, and then at the end just ending at the nipple. When you get out of the shower, lay on the bed real quick, do the same exact thing, and then you're done for the month. So if you do that once a month, you can pick up subtle changes that your physician, your primary care physician, your OBGYN, myself as a surgeon can't find as quickly as you could. The other thing, what can I do prepping for your mammogram? So again, getting mammograms once a year for screening. This has a little cartoon of a lady running into a door, running into a refrigerator, running into a car, and she's like, okay, I'm ready, let's do this. So she's kind of prepping for her mammogram, getting smashed. So breast care at Haywood Regional, just wanted to introduce the Haywood Breast Center. As I mentioned, Rod has been gracious enough to let me develop a passion of mine. So we have a center on the 2nd floor of the outpatient surgery center. So we have radiology, which has always been there, but we have excellent radiologists who are doing some specialized training in breast MRIs to make sure that we are a center of excellence when it comes to breast health. We have all different modalities for detecting abnormalities in the breast, and this one says, just a reminder that mammogramming your boobs is more important than Instagramming them. So we also have surgical services. We have 3 general surgeons in the area that love to take care of women with breast pathologies. Myself, Dr. Almina, and Dr. Josh Rudd. We do all kinds of variety of breast treatment, from breast conservation therapy with lumpectomies, mastectomies, which now have gotten very interesting. They don't just do a traditional mastectomy where we whack the breast off. We can do skin sparing options, which allow the plastic surgeons to have skin for reconstruction. I've even done a nipple sparing operation where you leave the nipple behind. It's a lot more better cosmetic result in the end. We do have plastic surgery that helps us out with reconstructions for women that have mastectomies, as well as when you have a lumpectomy, they can do fat grafting, which I think is just amazing. They can suck fat out of your abdomen and put it in your breast to make them even. It's a double pleasure. We also have support services at the hospital. There's nutritional counseling for those patients that are having trouble with their nutrition. There's this new program called the STEP program, which is designed for cancer survivor patients to get them back into health and fitness. You get 60 visits for $60, and you get to meet with an actual therapist who will design a program that's appropriate for what your level of activity is. And then once you've completed the program, you can get a membership to the Health and Fitness Center for a discount rate. There are some new studies coming out that suggest that the high-fat diet of the Americans is a lot of the risk factor for breast cancer. So there are some studies suggesting that exercise actually decreases your risk of breast cancer. So we really want to try to push our patients to be healthy. There's a program through the American Cancer Society called Look Good, Feel Better. It helps with skin care, hair care, just basically making you feel better after you've had cancer and chemotherapy. We can get you in touch with some of the local representatives for that. Power of Pink, which is a program that's sponsored through the Haywood County Foundation, helps to provide mammograms for patients who are uninsured or can't afford mammograms. And this data that I had from their website, as of 2007, there was over 1,000 mammograms performed. Of those, 742 saved people's lives. So that's a big program that we have going on in October. We also have a nurse navigator, Joanna DeWeese, who helps with meeting with all of our breast cancer patients. She helps to provide that transition between radiology to the surgeon, and then even out from there. She's been known to get patients glasses when they can't afford glasses, get them dental appointments when they don't have dental insurance. She's even got people that'll come trim trees out of your backyard if you have trouble with the tree falling. So she's been an excellent resource for our hospital. So, in reminder, check your boobies. And I put some candy on here. I know it's not sugar-free candy. I'm sorry. Yeah, that's probably not good for the hospital. But don't be a dum-dum. Get your mammogram. All right. I'll be willing to take any questions or concerns.
Any questions?
Appreciate y'all having me.
Okay, she did a great job of keeping us or getting this.